ಅದು ಮ್ಯೂಟ್ ಮಾಡ್ಕೋ ಅಂತ ಹೇಳ್ರಿ ಸಂಜಯ್. ಮ್ಯೂಟ್ ಮಾಡ್ಕೊ ಅಂತ ಹೇಳ್ರಿ ಅವಳ ಕಡೆ. ಅವಳೆ ಗಲಾಟೆ ಮಾಡ್ತಾ ಇದ್ರೆ ಕ್ಲಾಸ್ ಏನು ಕೇಳೋದು?
अरे ऐसे ठीक है. Yeah, the other one is not is too vertical. Plus it won't be stay in my stand.
ನೀವು ಸ್ಟಾರ್ಟ್ ಮಾಡ್ರಿ, ಎರಡು ಮಾಡ್ತೀನಿ ನಾನು.
Okay, let's start. Now we are going to talk about the screen. Contracted tongue on the screen. Okay, you have few more contracted tongue. Then we start. Keep the tongue on the tongue. The contractions on the screen. Okay. This one is mild right too. This one is hard also.
Yeah, big time.
Yeah.
Even urinate better also.
7 minutes here.
Both are.
Both are.
Where the
So
spleen?
not very.
Yeah, the screen is like here. This one, can you see this contractor? Can you see this contraction? This is, of course, there is heart and there is large intestine. Okay, we'll discuss about that.
They're not very well people. It's off. Hello. Maybe it just moved. What can I do? Now?
This is so funny.
It's not going to work.
We thought she was God. She would never be God.
Just tell her she can see the video after.
I think she's bored in the train.
This is not good.
Yeah, but we're gonna be bored with
Yeah.
pain.
Just leave it. She's
Pain in the left knee. So, you can say pain or weakness. Pain in the left knee.
Pitta aggravation.
Which one?
All pitta.
Yeah,
All
pain.
vata.
Basically,
Vata.
Vata, vata. Contracted tongue means the vata. We are talking now on the contraction tongue. Okay, so contractions on the spleen. Okay, with contractions on the spleen, if tongue becomes pale, then there is the iron deficiency. With the contraction on the spleen, if tongue becomes pale, then the iron deficiency. With the contraction, if tongue becomes a little bit white coated, like this, okay, and see the left tongue, with contraction,
Yeah.
if tongue becomes like little bit of the white coated, that means the people having a little bit high hemoglobin, okay, or there is more chances of what they call thickness in the blood thick.
Viscous. It's very viscous.
Yeah, viscous. Okay, the left side, this one.
What did you say? Thick blood.
Yeah,
So there's white coating and the tongue it means very thick.
If there is a contracted tongue, okay, then food absorbing capacity is very low. Assimilations and absorption, the capacity of your stomach is very low.
Absorption and appetite as well.
otherwise the contracted spleen will not give you many symptoms. With contraction liver, there are many symptoms. But contracted spleen will not give you many symptoms, and you will not find many cases of the contracted spleen because spleen mostly function on the fluids, right? So there is very less chances because why liver is affected more? Because liver is functioning on CO2. Okay, so congestion of the CO2, excess CO2, this is very normal in the liver. But in the spleen, when we will come on the congestion curve, that time we'll see there is more congestion issues, fluid congestions. Okay, because the spleen functioning more on the fluid. Okay, so there you will find the more congestion issues in the spleen. The protocol is the same.
But congestion is not contraction?
No, contraction is like this. The muscles or the organ itself become the contracted. Congestion, they are something stuck. Okay, one organ becomes like small. The organ is sink like contraction. In the size become the mind is small. Okay, congestion means there is lots of the fluids and toxicity. Congested, they are not moving. Okay. The protocol is the same. Spleen 1, spleen 9. Okay, and GT protocol.
Bless you.
Bless you.
Spleen 1, spleen 9, and GT.
Yes.
Alright. Okay, next one.
Kidney.
Yeah. Left kidney, okay? Contracted one on left kidney. This is a little bit very common.
So this protocol for this tongue is the same that for the teeth mark, right?
Yeah.
Yeah, for the spleen, yeah. Okay. Left kidney is little bit very common and give you very too much symptoms because what we discussed, left kidney filter
Acid.
acids and gas.
What is that?
Okay. So of course, if the gas is functioning with left kidney and acids, so there will be many contracted tongue, right? Like your liver is produce the acids and heart is circulating the acids and left kidney filtering. So the contraction tongue on this three part you will find in many cases. Contraction tongue on your heart and on your liver and the left kidney. Which nadi is Pingla. Listen, Peter. So I draw this one. Okay. Whenever your left kidney is contracted, okay, that means creating more vacuum. The contraction always creates more vacuum. So gas is more stagnated in the body. Okay. If there is a cracked tongue, then there is the excess movement of the gas. Means organ is functioning with gas which is too fast. Understand? If there is a contraction, the gas, you can say the gas is stuck in that area with the vacuum. See, the one congestion of the fluid, that is very different. The congestion is the gas, that's very different. For example, in the varicose, what we have, what is there is mostly congested
Blood,
blood and
fluid, or fluid.
CO2. In the vein,
CO2.
what we have in the vein?
Gases.
The gases mostly. The gases, for example, now in the vacuum is create air in my liver, and liver is not circulating the gas enough. In all my vein systems, they will get more pressure. The gas is not moving in my whole vein system in the body. Okay, so same when your like kidney becomes contracted. Okay, so what it's doing, your kidney is not filtering the enough acids and the
Yes.
gases. Then what will happen? This gas and acid will reflect again inside the
Left kidney.
body. Now what is comes in the left kidney, that is a pure toxicity. What's come in the, that's come from the whole body to filter this all things, and that comes like pure toxicity. When your kidney receives the toxicity, but your kidney is fully congested with gas, your kidney is fully vacuum with gas, and that is not filtering, that is reversing into your body. That is it. That is going to reverse inside the body. If this all toxicity will go again in your body, then where this will go?
Down your legs.
If this is going directly in your blood stream for circulation, then of course there is more high chances you will be die or you will be hospitalized immediately, because that is pure toxicity, no? The toxicity will not enter in your again circulatory system. That all toxicity in our kidney comes from all over the body. Okay, that's coming to your kidney to cleanse them. Okay, and kidney says no, I can't cleanse now. Now that much of the toxicity is going back in the body, then of course body is very intelligent. Body will not take that all toxicity. The body will take that much of the toxicity, and the whole body becomes toxic. Then that will enter again in your vein systems and will go to your liver again. Because of the CO2, no? Mostly gas and acids. Who produce the acids more? Liver. If your kidney is not able to filter, then this will go again to your production. Where this will go? To your producer organ. Now from here, when now it's going to filter. If your kidney is doing the filter, then this blood becomes red. Okay? If not filtering, then again the blood becomes the blue. And it will go to your liver. Okay? Now the first thing, liver is already detoxing your CO2, and there is lots of the acid which comes from your GI tract. Liver is already functioning on that. Okay, and a toxic acid which should be out from the body, that again comes to your liver. The liver have excess acids. Now in the liver there is the excess acid. Then liver try to detox as soon as possible, and what the liver will make? Liver will make lots of the biles. Liver will send lots of the yellow biles to your GI tract. Because if your toxicity, the acids and gas, is not exiting from your urinary bladder, from your kidney, then we have only second option, which is through your stool. From where this will go? From your GI tract, from the small intestine and large intestine. Then, for example, this is a large intestine, okay? And this is your small intestine. Now your liver will send this all excess level of the toxicity will convert into bile, and into your small intestine, and it's going to your large intestine. So whenever they enter lots of the excess amount of the biles in our GI tract, okay, so in that conditions, the biles create lots of the gastric problems because your intestine is also not able to absorb that much of the biles. This is now excess bile. What is this? Excess bile, because liver, if detoxing the normal biles, there no issues. So that's why whenever some patient is suffering with left kidney issues, though, the people always suffer with a gastric problem and lots of bloating issue. There is too much of the bloating who are having the left kidney problems. Okay? That much of the excess acid will burn your fat. And there is an excess amount of the acids. Okay? Will enter in your small intestine. For small intestine, the temperature level is very
Hi.
high. Okay, then your small intestine will produce the more mucus to protect from that temperature, and your small intestine use the more fat to protect that heat, to protect it from the temperature. Then their weight will sink like suddenly. The people are more skinny. When you see the left kidney is contracted, the people are more skinny. Sometimes the people will say, I lost weight suddenly like 5 kg, 10 kg. I lost my weight suddenly 5, 10 kg. People are very skinny. The second, there is gastric and bloating issues. Left kidney contractions filtering your acids. Then left kidney, when your left kidney is not able to filter the acids, then there will be more chances of the creatine and uric acid. Creatine level and uric acid will go high. Okay? Creatine and uric acids because of the left kidney.
When there is left kidney contraction,
Gray hair, okay? Gray hair and hair fall issues also. Gray hair, if you see the governing organ of your hair, bone and nail. This is the like in the traditional Chinese medicine, not the body hair, okay? Only scalp hair, bone and nail. This is governed by your kidney. The most left kidney is more responsible. Governing is the both, but hair fall issues mostly come from left kidney more.
And nails the right.
No, see, left kidney is damaging more. Right kidney is huge. What we discussed, vata is damaged more, pitta is the medium, and kapha will not damage that much. Mostly kapha create more congestion. Okay? So breaking, damaging, this all is mostly happen through the vata and pitta mostly. Okay? So when the vata is excess, then they will make dryness inside the root of your hair. Okay? Then hair will fall, and in the young age, when hair becomes the gray. So in that condition, also the left kidney is, you can say like responsible.
And what causes your kidney to not function properly?
The gastric of the left kidney, the contraction in the left kidney is comes from the very different causes. For example, if you are not drinking long time water, okay, the one of that case. Second, if you are not sleeping enough sleep, that is also affecting the left kidney. Third one is more important, that is our reproductive systems. Okay, so we have the left kidney and right kidney. Left kidney is govern our left ovary and left testicles. Right kidney is govern the right kidney, right ovary and right testicles. So functions of the left ovary and right ovary is not exactly same. Okay, both ovary. If you have the one ovary like to swing, that's very difficult for pregnancy. Through the one ovary, you cannot, become pregnant. So function of as per Ayurveda, what is saying, uh, the functions between the left ovary and right ovary, between the left testicles and right testicles. Actually, ovaries and testicles both are the very similar and exactly same. Okay, in the male, the testicles, and in the female, the ovary. If you see the design wise or anywise is and function wise is very similar. Do you know when baby is before the born the baby, where is testicles?
Inside.
Inside, yeah.
Like how the female's ovary is, no? Actually, there is testicle on top here. Okay? If the testicles is not going down, okay?
It's a girl.
This. This is like actually position of the testicles. Testicles in the head.
Inside. Yeah.
Understand?
Before born, our testicles is here, then slowly move down.
There is people that can, testicle can go.
Yes, they can manage.
There's this surgery that you can like cut this pathway of the testicle going out and down. Yeah, you can actually avoid the testicle to go up.
Go down.
No, go up.
Oh.
Because, like grow up and testicles can go up.
Now many doctors and scientists they are doing research. I read some articles. Through the testicle size, okay, and the positions, the people having like different emotions. Okay, they are researching like gay or the lesbians or the someone said bisexual. So this all is like different. So they are doing research and they find something which like your testicles is mostly responsible for this all reason. They are still not 100% sure, but what they found that is like this. Your your emotions level, your sexual thoughts is going as per your testicles position. Like the same transgender, there is purely like testicle issues.
Oh.
That's why they are not converting in female also and in the male too. Okay, so they try doing very good research about the testicles and this all. Okay, and after, if you remember, we discussed about the 7 dhatus. Okay.
Yeah.
First is like your digestive juice, then your blood, and after the blood is going to your muscles. After the muscles go to your fat.
Yes,
After fat is going to your
Bone marrow.
bone. After bone is going to the bone marrow, and from the bone marrow to going to your
Sperm artha. Sperm, shukra, artha.
after the bone marrow, the essence of the 7, essence of the 6, your all the dhatus, they are going to your testicles. Sukra and artha is essence of your whole body. It's essence. First you eat this much, then you get like this much of the nutrition protein. Then went in the blood. From the blood, the muscle will receive only this much of the energy. From this much of the energy, then your fat will receive this much. Then it's going to your bone. Then it's going to your bone marrow, and then it will convert from the sukra to artha. That in essence will go only this much. If you are going to take like one kg of like any plant's leaves, then you are going to make the proper minerals and nutrients. Any tablet, maybe from 1 kg you will get one capsule or 2 capsules. But that is very powerful, right? So yeah, so that is your essence. That is your essence of your body. That's why they are saying the sperms and egg. That is the sperm. That is your essence of your body and very powerful. Okay. Here, kidney is mostly responsible with your reproductive system. Kidney is mostly connected with your reproductive system. And your reproductive system is mostly connected with your natures and your maturity. The reproductive system mostly connected with your maturity also. Okay? Now, what is the function, the difference function between the left ovary and right ovary, between the left testicles and right testicles? The function is two mostly. Many doctors they are saying some negative charges and positive charges. Okay, and what I understand in logic, okay, no one know what is the truth, but what I understand the logic. Yes, of course they mentioned there are like the kapha, which is little bit of the heavy shukra and artha on your right testicles, and the light one is on your left testicles and left ovaries. And one more book what they mentioned. Proper filtrations of the essence is happening in your left testicle and ovary, and movement of the sperms and egg. The movement of the sperm and egg that is happening through your more left testicles. Okay, so that's why saying some in the case in the females, the doctor when they count the egg is proper like in range proper range and the sperms proper range, but they are immature, they are not reaching till, yeah, they are not reaching. Okay, if they are not reaching, then they are lying in between the path. They are not reaching because of the movement. We need the proper pressure. The pressure is comes from like they say the pressure is comes from your left ovary and left testicles.
I think if your right ovary releases the egg, you're more likely to get pregnant.
Yeah.
Yeah.
Oh, is that so?
Yeah.
So that's why mostly doctors suggest to check first like right ovary and this also. The productions, then the movement is they are saying that connected with your left testicles.
So
Whenever your left testicles and left ovary is more sensitive, okay, whenever your left ovary and left testicle is more sensitive, the people have the premature education. What's it called? Ejaculations. Right?
Oh,
Ejaculation.
premature ejaculation.
Ejaculations.
when
And left ovary and left testicles are more sensitive. Okay, so they people have more premature ejaculations.
Female is only for men, I think.
Yeah, mostly for men. I'm not counting the
Yeah.
okay. So that's why if you go in the army, they check your testicles too. The army test, do you know that? When there is army test, no? When you're going to pass the all exam and after there is like a body physical test, that time they check your testicles too.
Oh.
Why? To see the size of them or what?
If there is the one is small and one is long, then these people having the little bit health issues and emotional issues. And yeah, your both testicles should be like on the
The
when
same
happen,
level.
yeah, when this is happening with many people. So one testicle is a little bit like more down, one testicle is like a little bit up like this.
No, but that I thought was everyone. All of us have one because the body wants.
No, after the little bit age, that's normal.
I think it was because of some friction or some heat or something. Body doesn't look it. This is-
Yeah, some.
Oh, the heat.
Because
Well,
they're never in the same.
Same line.
Which she's asking. Bully, what problems will come because of that?
Yeah, yeah, we'll come there.
We'll come to that.
So testicle and left ovary, they are on charge of the
This
circulation.
is the proper picture of
Circulation and pressure.
your proper journey of your testicles from the heaven to earth.
Because when you're a baby, you are the
Yeah.
testicle
Is
is
it starting? Yes, it starts from here like this. And slowly, slowly from here, moving.
There it comes up.
Mostly it's stuck more here. This cause some vein or a huge big one.
This happens at puberty time, when the child is 12, 13, the boy was at 10, 11, whatever.
Okay.
what
So
for the
left
army? Is it?
testicles.
For the army? What age are they when they go to the army? 20?
Yeah, 18, 19, never before 18.
So they're young, so they're just
That's long,
the
yeah.
same level.
Okay. So left testicle is little bit bigger than the right one. The left testicle is little bit bigger than the right one. Okay. So if there is a just mild imbalances, for example this one, a little bit this one like this, that's not an issue. Left one is mild bigger, not issues.
Is it
You
the
check-
same with the
yeah.
ovary?
Hmm?
Is it the same with the ovary?
Testicles. In female, I think the left one is. Okay, I'll check it. I'm a bit confused there. Let's check. Okay, left one is little bit this one, and that's why if you ask the army people, they love to give the physical exam on the winter time. Winter times the body is due to cold, body's contact, so they pass the exam more fast. Summer times there is too much heat. Due to heat, your all skins become the loose and like this. Okay, so that times your testicles is the skin is going more like down. So they see the more difference that times. Okay, so many students they they out from the exam through the just testicles. Okay, so mild imbalances, that's not issues, but if there is a major one, they create pressure on your reproductive functions and on your kidney too. Both is created from problems in your reproductive and in your kidney. Okay, so we'll talk now on about the symptoms. Whenever your left kidney contracted, the gastric problems, uric acid, creatine level,
Gray, hair fall.
yeah, gray hair fall,
Nails.
perfect.
It's like brittle nails.
Brittle nail also comes from your left kidney.
All nails problem coming left kidney.
Which joint will be affected?
Which part?
Joints.
Oh, the kidney. Kidney is shoulder.
Yeah,
Knee का short sleeve है sir.
Kidney
the
shoulder.
right
Yes,
shoulder.
Middle side.
Right?
Right shoulder. Or sorry, left
It's
shoulder.
shoulder.
Left shoulder.
It's shoulder, knee.
Yeah. It's shoulder, knee, hip.
Yeah.
The left shoulder.
What's up with
Yeah,
that?
left shoulder. because so far as I remember, creatine levels are very low naturally. They become high for infections and inflammation.
Why do people take creatine then? Supplement with creatine?
That's different though.
Just people supplement with creatine.
That's affecting your kidney a lot.
Okay,
The
so
supplement
you
of
damage
the
your
the
kidneys.
supplement of the creatine, the supplement of the cholesterol, the supplements of your
Hey, go on mute.
calcium. This is affected on your kidney a lot. Because in your kidney, what supplement are you taking? We have two types of the vitamins. One is resolving with the water, and second one with the
Fluids.
one is little bit more oily. Okay,
Fat.
and second one is more
Water soluble.
the water elements. So our kidney is functioning on water, and which any medicine which is
Water soluble.
water solubles, the movement of that vitamin is very fast. Okay, and they create, if you eat for a long time, they will create more dryness. Okay, left kidney contractions. If there is more dryness in the kidney, then what we are going to create more? Creatine levels, these issues, uric acid issues, these all issues. That's why mostly doctor do not suggest when there is dryness in the body, doctor do not suggest the calciums. Because calcium, when they will reach in your kidney is not able to absorb that calcium. Because there is already dryness now. Okay? So that's the more high causes of the kidney stone.
So you should check their tongue before
Yeah.
prescribing calcium.
So mostly doctor check the body dryness. Okay. So in these conditions, what happen when your left kidney is contracted, and if you are eating any type of the little bit high protein food, which is like dal or rajma, okay, these types of the food, there is a high chances of the this kidney stone. That's why doctor, if you have the mild kidney stone, doctor suggests you don't eat this all seeds while you can
Because there is
beans,
already,
Lentils.
Mung beans.
because they already,
All
they
the
are already
other
rich in
vegetables.
this
yeah.
Yeah, Baba.
basement. And
How do they?
Eating down?
So when your kidney is not able to process it properly, already there is high in your body. So you don't need to eat anything high protein food. Okay, because there are already reflection in your body, no? That's not going out from your body. So in the this one, the contraction on the kidney comes from your urinary bladder also. Frequent urinations, just write frequent urination. Recheck on it. Recheck on case, recheck on the way. इसमें भेजो.
An ultrasound or something?
There are some tests you can check from there. But mostly what happened, mostly they check through the blood and through this type of a test. But when there is dryness,
Yeah.
and there is a dryness, so there is no test to check any type of dryness. They will mostly they calculate the dryness through your blood count level. For example, your creatinine is going high, of course there is dryness in your kidney. Understand? Whenever you have the osteoporosis.
So there's biomarkers for it.
Yeah. So they mostly check like this test, but there is nothing test directly which can check your kidney level.
What about when they do an ultrasound and they check the size of the organs? Like if the size of the organ is small, it's contracted, no?
Yeah, so many times they doctor checking for, especially for kidney, of course they doctor check the size. And many times they mention left kidney size. If you see the measurement, they have to mention like 0.8 mm into 4.7 mm into 4.6. On the MRI, if you see, and on the ultrasound, you will find this size. Okay, how they are checking? They are checking the length, width, the wide angle, and thickness. Okay, so sometimes you will see there is mentioned doctor like the left kidney is little bit shrink, they smaller than the normal size. Many times the doctor mentions about the kidney size too. Okay, but sometimes what happens? Some specific part of the kidney become the sink. So that's why the whole process is not imbalanced. For example, in the one kidney, how many we have nephrons we have?
How many?
Nephrons.
Millions, right? So if you see the small, many nephrons, right? There are many nephrons. So some specific part of the nephrons it becomes like dry. Then that will not change your whole kidney size. That will not your kidney will not sink fully.
Yeah.
But of course, if some nephrons is not functioning, then there is more pressure on your kidney. Understand? Then this nephron also affecting your kidney. This nephron is also affecting your kidney. Secondly, left kidney contractions. When your urinary bladder muscle become the weak, okay? When your urinary bladder muscle become the weak, what is the cause of the weakness? Many causes. Related to your nerve system, okay? Related to the lack of the water also, and related to when you are sitting for the long time like this, that also created of the issues for long time. And when you have the gastric issues, they are always keep pressure on your urinary bladder. If you remember, we discussed prostate gland is the prostate is never ever affect itself. It's mostly the cause of only your large intestines and urinary bladder. We discussed if you remember.
Yeah.
Okay, exactly same when you have a little bit of the constipations or the gastric in the large intestine pressing your urinary bladder. So always they keep pressure on urinary bladder, and your urinary bladder becomes weak. Okay, so when your urinary bladder if you become the weak, so what is the function of the urinary bladder?
Storage of urine.
Hmm?
To store.
Okay. If you remember, we discussed about the bladder. This is your bladder. If you remember, we discussed about the bladder. Like this. Your bladder is yeah. One is connected with your right kidney, and second is connected with your left kidney. When your bladder is contract, they will remove your
Urine.
wastes, right? They will remove your urine. Now the bladder is fully empty. If you remember, we discussed gallbladder and urinary bladder have more gas storage, and through that gas, through that vacuum of the gas, the circulations of the urine is moving. Okay. For example, when your urinary bladder become it's like contract like this. Okay. Then everything you remove. And this is the pure like balloon. This is the pure balloon. When it's going to expand again, in creating vacuum. Whenever they are creating the vacuum, they pull something from somewhere. Without pulling, the bladder cannot expand. So what happened? Whenever you are going to release the urine, you are giving lots of pressure. Pressure of the gas is like one of the strongest pressure, right? So there is a wall. When you give the pressure, this wall becomes open. Okay. When you are fully empty with urinary bladder, now this wall becomes again closed. And when you are going to when the bladder is going to expand slowly, then this time your urinary bladder is pulling the more gas and acids from the and fluids from the both of the kidney. Kidney is going to expand slowly. Sorry, the urinary bladder. And with the expansion, your bladder is receiving the more wastage. But when your bladder, the muscle becomes weak, when your bladder muscle become weak, not able to expand properly. Okay. This side, water is little bit heavy. The water will be circulate little bit, but the gas and acid is not coming more here. So when left kidney is contracted, then the people give the more symptom of the yellow urine and it's little bit smelly and more foggy urine. Okay? When there is issues from the right kidney, the urine is little bit more thick. Okay? And like a sugar type urine. Okay? When you will go for when you will pee, after that there will be some end will comes. Okay? Have you experienced thick urine? Like you understand thick urine? Urine is proper white urine, not the yellow. Urine is fully white and little bit oily type, like sugar type urine. When you
When you have a right kidney problem.
when right kidney problems, urine is not yellow. Urine is plain white urine. White means the colorless.
Colorless.
That urine. Okay, and little bit of the thick urine, little bit like oily type urine. Okay, when left kidney is contracted, there is more
Yellow and smelly.
yellow and smelly, and second, the third one is more fog on the urine. Bubbles. क्या बोलते हैं उसको?
Cloudy.
Cloudy.
Which one is sweet smell? The sweet smell comes from problems with which kidney? Right kidney.
Has to be right then, because right one is sugary.
Okay.
The pressure of urine, if they having lots of too much pressure, that's come from left kidney, and many people they don't have the enough pressure. The pressure of urine. Okay, that's issues of your right kidney. They are like they are going urine and stop, and going a little bit more and stop. That mostly connected with your this one also, like prostate also. Okay, but one of the cause of this also. When a doctor will check, no, you don't have any prostate issues. There's many cases like this. You don't have any prostate issues, but still the urine is like not with the flow, proper flow. Okay, so that means that connected with your right kidney.
Last. Height then. She.
Yeah, that is case, no? You are dating.
Mm.
When you check, there is no problem in the prostate.
Who are we talking is a patient?
There is one patient, he was a tourist, he came for some time within one station of the acupuncture and he cancelled his flight. He was going back and he cancelled, I want to expect like some more days. Maybe I get good result after the long time. I took the all medicines, everything, there was no result. But maybe I feel I will get good, I will be cured from here. Then he expanded his flight and there was good result, right?
Mm.
Yeah, he is happy with the result. So when you check the old test, there is nothing in the test. Right?
Nothing.
There is nothing in the test, prostate, everything is very young, like around 35-40 years. Now try to do more acupuncture so you will get more confidence.
He even asked me to put auricular for him, so I did.
How you know you are doing auricular?
What?
How he knows you do auricular?
No, Isabel asked me to treat him.
Try to what you learn already, what you know. If you practice that, then you will be maybe miss this subject. Try to practice more what you are learning, so you will get confidence. Is there result or not? If there is no result, then maybe we'll try to find out some new result. Understand? I have no issues. Like after the course, if you are here, you can practice both what you want. But it's better what you are going to learn. If you get result from that, then you will get good confidence. If you will not get the result, then we will go to clear the doubt why there is no result. Okay. So urinary bladder will check through the abdominal diagnosis, urinary bladder weakness or stiffness. Then we will check the diagnosis of the large intestines. Sometimes when there is large intestines, there is a stiffness in large intestine, there is congestion, gas congestion in large intestine. That time also patients having a frequent urine issues. When we were talking about large intestine, if you remember, they contracted time here. So what I mentioned, if they contracted time on the large intestine, then people having frequent urine issues because they are pressing the urinary bladder. Okay, so left kidney contracted. Right, just a few more points. Left kidney contracted. What we write? A left kidney contracted, the blood pressure sometimes go a little bit low. Right kidney contraction, blood pressure will go a little high, and left kidney contraction, blood pressure will go a little low. Okay. Bloating, gastrics, okay. Gray hair fall issues, and
So we
if the male, then premature ejaculation, okay, and frequent urinations, yellow urine and coloid urine, okay. What else we discussed? Weight loss,
weight loss.
weight loss. Then,
Creatine and uric acid.
yeah, uric acid, creatine level, uric acid and creatine level. Bone density become weak.
That too.
Yeah. Because when your left kidney is become the contracted, of course your calcium and magnesium is not absorbing properly. Bone density become weak.
So if someone has like osteopenia or osteoporosis, you shouldn't just prescribe calcium. You should check.
Let's check the kidney.
It's little bit difficult. Good doctor, they suggest first start with vitamin D3, okay, and slowly just take calcium for 7 days and stop, okay. Then take after like this, and mostly the doctor, good doctor, they suggest, for example, in Ayurveda. Ayurveda there is 1-2 medicines which help a lot to reduce the like Chandraprabhavatika. Chandraprabhavatika is very good medicines to reduce the dryness from the kidney. Now the doctor also like saying Chandraprabhavatika is very good for the calciums. So they are suggesting like this is good for calcium. But actually Chandraprabhavatika medicine is not functioning on your calcium's level. Actually what the function is doing to reducing the dryness from the kidney, and of course automatically your body will start to absorb
More calcium.
more calciums.
That's
Only this formula in Ayurveda is going still perfectly. Like ashwagandha. Ashwagandha is very common to give. If you have dryness in your body, just take ashwagandha. Means ashwagandha will function on some specific properties. Right? Not like on whole body.
It's
Because dryness comes from different part. Your left kidney will create dryness, your liver will also create the dryness, maybe your intestine, large intestine also create the dryness. The taste of the three organs are completely different.
So how do you take ashwagandha without the power?
If you are healthy, you can take ashwagandha, no issues. Okay? But if you are taking for the health related problems, then ashwagandha will not function forever. Ashwagandha functions very good when there is a excess vata in your spleen. Ashwagandha functions when you have the teeth marked tongue or contracted tongue on your spleen.
It will work that well.
Yeah, then it will work like as a medicine, not protein and nutrition like that. Alright? Okay. Okay, Madam Ji here. Can I show you some pictures of the leg kidney contractions?
Is that the Chanda whatever medicine? That's the one they give for UTIs as well, is it?
Did you see that?
It's called. I took it before actually. Chanda something. It's the for the
Good morning, ma'am.
if it's contracted, like if someone's asked to go.
See, this is the both kidney contractions.
This.
Okay. see this tongue?
Yeah.
This is the contractions on the
Kidneys.
both kidneys. Okay.
That's just the right, is it?
She's saying if it's hammer tongue from behind, does it mean
Yeah.
contraction in both kidneys?
That's
Yes.
left kidney, is it? Yeah, yeah.
This is the
both sides.
No. Left kidney only.
This is side effects of the
Left
weekend.
side. Left side.
Don't remember, I don't remember exam, okay? I am just trying to complete this tongue diagnosis subject and I
Will you
take
send the
exam.
You can't
PDF
take
as
it
well?
today.
PDF, when we complete this tongue diagnosis, then I
Yes,
send you to
in
PDF.
PDF.
Okay? Look at me, this one?
Left.
Also left.
Also left. Okay, good morning. Okay, so this is the one tongue. For the left kidney contractions. And what this
Whoa.
That's
This is like a cut.
Don't give reaction to patient, okay? Okay, this is the left kidney
This looks like
contraction.
a cut.
This is left kidney contraction.
Yes.
Is it Chandra Prabha?
Chandra Prabhavati.
Can you imagine like how tongue is changing?
I know, it is just unbelievable. And it changes rapidly because it is current.
We never, for example, if you are not working in this profession, we will never check someone's tongues, right? When we understand about the tongue, each and every person's tongue is changed. Even who is eating all the same food, everything, lifestyle, but your still tongue is going to change. Tongue is like purely the reflections of your internal head.
Why is it the tongue?
Huh?
Why the tongue?
Because we talk of the tongue. Not only tongue, is there is the reflexes of the all the sensory organ. There is diagnosis about the eyes also, do you know?
Yeah.
I just know about only one eyes diagnosis. But there is eyes diagnosis. There is diagnosis on your nose too and on your ear. And there is the diagnosis. The many people do diagnosis on your palms. You know that?
Just palm.
Just palm diagnosis. Through the palm diagnosis, they decide what diagnosis you have.
The right hand though.
Okay.
The
But
left
tongue,
is
why
the
tongue is more reflective organ, like they reflect your all the symptoms. Because on the tongue, each and every second, the circulations of the taste, the water, and water will give you the pure sign and symptoms. Bring the all your what you have. For example, if your taste gland is not able to receive the proper essence from the organ, then it becomes dry. And the dryness will give you more contractions and maybe more crack. If there is more gas moving, then the gas will move on to your taste gland. It will create more dryness. Okay, if there is more contraction, then your tongue will contract. If there is more acid, then there is little bit of the essence of the acid comes on your tongue too. They will change your color. Okay, and there is enlargements too if there is more congestion. Tongue is like a purely soft tissue which is connected. In the very book they mention like 10 fascia is connected with your internal, all the visceral fascia. Okay, but I don't know that it's true or not. But on the tongue, the symptoms that are very like genuine symptoms of giving you many like in allopathic doctor also they love to learn tongue diagnosis.
Yeah.
So yeah, they easily they can prescribe or they can suggest some specific test. That's more easy because sometimes the test in allopathic is very difficult. For example, if you are going with some complaint, you are saying I have these issues, they will suggest you some blood test. But when they know, oh, there is this specific test for the liver only because there is just liver contraction, this is the issues. Then they are more specific, go and check the liver. I have many allopathic doctors which are more, oh my god, very easy to suggest anything. And the people also impress, oh, he directly suggests the same test. And this is the imbalance. But sometimes symptoms are very similar. Right? For example, if this is the case, urinary bladder. The doctor suggests all the tests. Go and check that this and this and this and this. Now, if you are like allopathic doctor and you know tongue diagnosis, you say, okay, there is nothing within the bladder weakness. what you can do, you do good massage on your bladder. Okay, go proper for the morning for washrooms and drink water very slow, like how Israelites drinking one sip. Right? Suggest always patient when there is dryness on the specific part of the organ, specific large intestine and your kidney is contacted. Suggest them to drink water very slow. Okay, liver also, you can suggest for liver too.
Anyway, that is a good habit.
For everything.
Yeah.
Even eating slow is a good habit. Not that I do it.
The teeth as well, they correspond to a different organ. Did you ever, you know, if someone's tooth.
Do you know in the English language of like Bengali people, they never use these words like eat the water, sorry, drink the water.
Yeah, they say cow.
Sip.
They say like eat the water. Khabo means the khabo, na?
They use the same word for eating and drinking.
Yeah. So they say
Jal
like,
khabo.
yeah, do not drink the water.
Eat it.
Okay? So means just take one sip in your mouth and rotate 1-2 times and put in your body. Okay? So drinking like that. They think that's not good for health. So khabo, always remember, water khabo.
The
So I was one time when I hear something and I said, how you eat water? Then they said, we don't drink anything, we drink just alcohol. we eat, we eat like tea, we eat like water, we eat only. Okay, man. Then I said, okay, that's good. Because each and every language, sometimes we make the fun, but there is some specific reason behind that why they use that word. Okay? Yeah, who was asking?
Oh, I was just going to say about the water. You know, you were talking about transgender and stuff like that. Like water, it's treated for heavy metals and chemicals, but it's not treated for hormones. So that's why now there's more gays and lesbians and transgender, because the water we're drinking has hormones in it that are like affecting. So people who drink from well water, they're fine. But if you drink from the main system, you're more prone to hormonal
Is there other
imbalances.
studies that show that?
Yeah.
As per me, too much mineral water, that's not good for the health.
Yeah.
What we are drinking, the
Stone.
distillery water, this salts. As per me, too much that water is not good because what we drink from the mineral water, okay, we have to give some work to our body to let decide to our body. Our body will decide which is the more I need, which I don't want. Because we need toxicity in our body. Without toxicity, there is lots of the thing which we cannot, produce without toxins. Like bile is pure toxins, no? Yeah, lots of things we require for toxins, our cell will more work. And mineral, the pure vessel water, this all, well water, this all, that is for little bit, I think, more good for the health. And the distillery water, because they filtered the all water for many times. If we filter that water, there is lots of the good thing also you are going to filter. Am I right?
Yeah.
So,
And there's fluorine in the water, which calcifies your pineal gland. So like a lot of more people who are connected, they're well watered, they're in the countryside. Whereas like people in towns and cities, there's so much fluorine in the water that the pineal gland is calcified.
Wow. Too many years in the cities now, I don't know.
That's why you have to avoid to use paste
Toothpaste, yeah.
Toothpaste.
What toothpaste, what?
Because it has fluorine in it.
Yes.
Like fluorine is a poisonous gas. Like it's
Yeah.
not good for you.
I'm going to get water now. You guys are- I forgot my bottle.
in the traditional time, how they filter the water,
Stones.
With
Coal,
Coal, yeah, it's alcohol coal, right? Yeah. Then what else?
like sediments, like stones and rocks and the earth.
Yeah. Okay, so there is like a big stone, then small stones, then sand, then coals. Okay, then what is coming through the cloths, what is coming out.
There are
Very
some
tasty.
places.
We'll get all minerals.
There are some places in the north part of Argentina. Many places they don't have water from good water. They are still doing that.
Still there, yeah?
It's very
Children what?
the filtration,
Filtration
like in the
plant.
ancient time, like with the rocks and sand and
That's
then
how
they-
and the
groundwater
Is used.
filtered.
Okay. And now we talk about the right kidney, then we use the word same protocol for the left kidney and right kidney.
Also doesn't matter what protocol is.
Yeah, left kidney we use on the left side, the right kidney we use on the right side.
That's all.
The protocol is going to be the same
Yeah.
from the spleens.
Right and left.
I said
Right
like
and
this.
We will come to
We
it.
discuss
First we
now
will
on the right kidney,
symptoms and then
protocol of the left kidney, right kidney same.
Oh my god.
Okay. This is the right kidney.
yeah.
Right?
So,
It's the very back.
Yeah. Heart and pericardium always
Yeah.
very common, right?
It's hard and
If they are circulatory, no? If there's circulatory issues here, filtration, then they will affect first circulatory system. If there is anywhere congestion or access, they always affect circulatory.
Yeah.
If there is blood is stuck here, then your heart is demanding for blood. If it's going too fast, heart is working too fast because it's circulatory organ. Central circulatory organ of your whole human body.
But on the ground,
Oh, sorry.
it's showing it. This is another problem. This is yellow and not the pitta issue. Rama issue.
Yellow is ammonia.
But now, it changes also very rapidly, right? If I have a stomach upset, my
That will give you good symptoms sometimes.
yeah, and then as soon as my stomach is okay, those symptoms will go away. It changes rapidly.
Left kidney was connected with your left shoulder, the right kidney is connected with your right shoulder.
Yeah.
left kidney, right shoulder.
Left, right.
Okay, sorry, menstrual cycle. When your left kidney is contracted, that times girls are suffering with the loss of the cramps. Okay, and they maybe a little bit of heavy blood flow. Okay, cramps, lots of the cramps.
On the right kidney.
Left kidney.
Left kidney.
Yes.
Menstrual cramps. CRAMPs. The pain. Not
Too much cramps. Okay, and little bit heavy flow of the blood. kidney is contracted, menstrual cycle delay. Delay menstrual cycle. Right kidney affects a lot on your heart and pericardium. Okay. Uh, when we come on like psychology or acupuncture and and physiology, that time there is one cell. It's called the mesothelial cell. Okay. That's produced through the kidney and going in pericardial fluid. Mesothelial cell. Mesothelial or thelial, I think so. Thelial, right? Mesothelial cell produced by kidney, but most of the production is happen through your right kidney. When your right kidney filtering the fluid, no? Essence of some that fluid, they will create the mesothelial cell, and that's going in your pericardium. And when that's enter in your pericardial fluids, the both chemical is like different chemical. There is some chemical reaction happen, and they create the one resonance. And that resonance is going to the all around your visceral organ fascia in your triple bomber. Okay? So whenever right kidney is issues, they mostly connected, they create the more issues in your heart and pericardium. Mesothelial cell. Mesothelial. Okay? Again, the right kidney is like your weight gain. So left kidney if it's congested, then create the weight gain. Contracted right kidney. Weight gain.
Weight gain. Oh, yeah.
Opposite of the
Right kidney?
Weight gain.
you become heavier.
Right kidney will not give you any uric acids or creatine or bone density problems. Right kidney, if your right kidney is healthy, you have a good bone density. Okay? And fluid congestions. Fluid congestions in the body. Sometimes edema happens to your right kidney.
What is it?
Edema.
Healthy right kidney, the people having a more, thick hair.
No health.
You don't need to write that. Left kidney weakness, hair issues. But when the right kidney, the people having like very thick hair.
It's more copper.
Yeah. Right kidney function on the kapha, no? If right kidney is not functioning properly, what we discuss congestion. The congestion of the kapha, and mostly sometimes it will create issues in your spleen too. Because when your right kidney is not filtering the fluid properly, then the fluid will go more to your spleen. When left kidney is not able to filter the acids and gas, going to your liver. And when your right kidney is not able to filter the proper fluid, that's going to your what? Spleen. So that's why maximum times, this is not on a 100% case, but maximum time you will see the right kidney congestion, they will create your sinus issues. Right kidney congestion, they will create your sinus issues.
The kapha sinus.
Kapha sinus. What is a kapha sinus? Fully blocked here. Okay? Okay, otherwise right kidney is kapha kidney, right kidney is kapha kidney. Okay, so it will not create or it will not give you many symptoms. Understand? very effective protocol on contracted tongue. UB23 is the back, is the shoe point. UB23, the shoe point of your kidney. If you are using for the right kidney, then use the right side of the point. If you are using the left kidney, then use the left side. Okay? Kidney 10. Kidney 10 is a kapha point. Kidney 10 point is a kapha point of your kidney. Inside the knee. Exactly. Between your semitendinosus and semimembranosus muscle. When you touch this muscle, this tendon, no? See, there is two tendon.
Yeah.
One is highlighted,
Yeah.
and on the medial side, one is deep.
Yes.
Can you see the two tendon?
Yeah.
Between the two tendon, and exactly in the
The
crease.
soft part.
Okay, very effective point. This point is very effective for the this also for your.
It is four, huh?
Kapha point of the
It is four.
Oh my God! Really? There are only two muscles. Wow! Only I think here the medial side. When you do like tight, you have seen like
There
this.
are two
You see the
tendons.
big tendon.
Yeah.
That is the semitendinosus. And middle side of the semitendinosus, little bit you press here, and you will see that one is small more tendon. That is semimembranosus. Between the semitendinosus and membranosus, exactly there and inside the crease.
Inside the crease.
kidney 10 kapha point.
Sorry, Chris.
Kapha point of kidney.
Between the line. This line is the crease. The line that is formed because
Cheek.
of
Put
flex-
finger like me like this.
that.
That's the bone.
See, see.
Medial side.
Put my finger here. Where are you? Can you see two tendon now?
This is your tendon.
Yeah.
This is your.
That is a
The-
semimembranosus.
The
We
kidney
do
side
practical.
is
Kidney,
outside.
kidney practical on everyone. This is one of the best. If you, it's called like this. If you filter your kidney properly, you are healthy. Because filtration is the more important.
Yeah, removing poisons.
Filtration is very, very important. If you are removing your poisons, automatically your body will reduce something. Otherwise, there is no other option. Because when if there is a production issues, if your body is not able to produce enough nutritious protein, then what your body will do? Your body will not allow to filter more because your body will reuse the toxicity.
So one question, in all this, just many of these issues are arising. What if you reduce the intake of your food, or you don't take food for 5 days, 3 days?
Fasting.
What if you give your body time to,
Repair.
like my kidney is not able to detoxify, whatever reason. If I'm not giving my body food for some time, then I am giving my kidney a chance to at least.
It's like this. It's like this. Depends on your imbalances. If you do fasting, then that's the healthy. Without imbalance, for example, if you already have like high pitta and high vata, and you are going to do fasting, okay, that is little bit dangerous. Okay,
Oh,
if your kapha is imbalanced,
That's fine.
that's very good because in imbalanced kapha, that means you have already lots of free radicals. People are little bit fatty, okay, obese, and there is more kapha. So what your body will do when you are not giving, for example, if I give you 10 apple here on your table, just eat this apple. What will be your first reactions? You know, unconsciously, what you will do? You will select one apple.
yeah,
In 10 of that, you will select one apple.
best looking one.
Perfect. When we go to buy the vegetables and everything, what we do? We will, from the 10, we will take one of the best one.
Yeah.
Now we already took the one of the best. Now there is only 9 apple. What you will do again the same? And after that, if there is 2 apple and both of are dirty, in that also you will eat.
Yeah.
What you will eat? The best one. And last you have only 1 apple and that is also dirty. You will try to take out from the damaged one. Right? So, when you are eating lots of the good food, you have already storage. That means your body is not functioning properly. When you will not eat, then your body will first, your body will give you hunger symptom. Please give me something, please give me something, that will demand. Still, if you are not giving, then your body will start to use your storage energy. What your body will do?
Use the storage energy.
Your body will use the storage energy, which is your body will try to find out the nutritious protein from your fat, from your small toxicity. You detox your body very deep cleanse.
So it's good for you.
Yeah, good for
Kapha people.
Kapha people.
Or
For the
kapha
Vata
guys.
and for the Vata and Pitta, there is different fasting. Kapha people, I mean like Kapha people fasting, completely stop the food.
So people like me, we can if I stop the food for 1 day, it's good for you.
Yeah, Vata
Drink
people.
water, lots.
Yeah,
Not drink water. Yeah.
Vata people fasting is little different, and Pitta people fasting is little different.
So you are going to cover
What's the
this.
difference between them?
Are you going to cover this?
Yeah.
I'm asking.
Yeah, we'll cover.
Then-
When the Vata people fasting, the doctor suggests, especially in Ayurveda, eat little bit of the sweet product, anything. Do fasting completely. Like banana is little sweet. Okay, what we have in little sweet quantity, like you can jaggery, that's very good. That will help you more to lubricate your body. Okay, because if you are eating the vata, if you are eating little bit of heavy meal, the body is not absorbing. Pitta people, the doctor suggests more, do fasting but eat little bit of the fruits. What you have to eat? Little bit of the fruits. When you are doing the kapha fasting, completely stop. So if you see that in Hinduism, so there is three different fasting. So there is one time will come, that day no one will eat anything. So this is fasting as per your body prakriti, or you can say vikruti. If you like, my neighbor who is doing fasting for 10 days, not eating anything, and so I will go to do fasting for 11 days to break his record, because I will not eat anything. The see size of the body and vikruti and prakriti, then we start competitions. Okay, so
He has enough fat and you don't. So you have to-
yeah, they have enough storage energy. They have enough storage energy, so no need to eat anything. And always, when you are breaking the fasting, okay, always start with sweet.
Date or something.
Yeah, whenever you are going to break the fasting, if you are directly eating any meal, no, that is very harmful. Because long time your intestine was dry. And directly if you are giving anything, your body will not absorb. Maybe you will get the fever or some different health issues.
I like
That's
to
why-
try olive
Oil.
oil.
That's why for you, maybe when you break your fast, you eat a date, right?
You
In
first
during
start with dates,
now,
then little water.
right?
Oh.
After finishing
So-
prayer,
There's a logic to it.
Any type of fasting, vata,
Yeah, it doesn't
pitta,
matter.
So see, not put the religion. I'll say one good story.
We should just follow what they've been doing for 1,000 years. Instead
But
of
for
this.
women, it's different because their menstrual cycle. So women should only fast from day 1 of their period to day 14, whereas from 14 to 28 they shouldn't,
They shouldn't.
because their hormones, it'll create more hormonal imbalances. Men, you're 24-hour cycle, you're with the sun. Women are with the moon, so our cycles are different. So fasting is fine for what?
You have to be sensible about fasting, just don't randomly do it.
So in the Vedas, if you read, Vedas is mentioned like this: when you are going to eat food, okay, the first two thing they are doing, they are putting the water like circulations like this. They are saying like you filter your cosmic energy or anything which is I don't know. But one best thing what I like, what you are going to eat, put little bit that all food on the fire, which is next to your plate.
Yeah.
And what the smell will come out from that fire, no? That is your essence smell of that food. And what you will smell, they will open your all that sweet glands channel. Then you will eat that, no? They will digest more purely.
That's why.
Oh.
That's why you cook your own food.
Okay. The second what they said, what you are eating the food you don't have the proper smell, no? and your body will not absorb that much. If someone having appetite issues, you just go and give them a very good smell food. They will get hungry very easily. For example, I have appetite issues. I'll not eat every day or on the time. For example, sometimes I eat only at night time, sometimes I eat 4 times a day. My life cycle is very fully mixed up, okay? But whenever someone is cooking the good food and the smell is coming, immediately I will feel the hunger. So who is having issues with hunger, issues like appetite, if the smell is good, so that's why always in villages when people is going to each other home, no? They always put some types of these so expand that smell. They say, oh my god, the people are cooking the food from the pure heart. And if they cook the food and the people are going to eat, they said, have you cooked the food? No, I couldn't feel the smell, smell that what you cook. So they are disagree with these people and not cook from the pure heart.
Oh.
Do people
Yeah.
who can't smell have a lot of asthma, like a lot of congestion? Like if they're because they
Not
don't
that
take
smell.
any smells.
Not that smell.
Okay.
When we are cooking the food, what the smell is
Yeah.
coming, no?
Yeah.
That smell will open your all taste gland.
Yeah. But you say someone who can't smell.
Yeah. So maybe that smell will help. Or through acupuncture, of course, when we do acupuncture, we open the sinus cavity and through the lower intestine, so we open the smell gland. Sometimes, if someone having smell issues, ask them, they have the digestion issues too.
They do.
Someone having smell issues, they have the digestion issues too.
So also you can't taste your food if it
Yeah.
smells a little
Yeah.
off. Like when you're cold, food doesn't taste so great.
When it's cold, is it?
When you have a cold,
Oh yeah.
the sinus, your nose is
Yeah.
blocked,
Yeah.
and you're eating.
Yeah.
food is
Yeah.
not so
Because if your sinus cavity is blocked in your nostril, of course they are blocking the taste gland also.
Yeah.
Yeah. So you don't taste. The
In that type, mostly the religious people used to give the more high temperature food.
Why
High
temperature
temperature-
food tastes better?
To
Yeah.
open up their sinus.
The sinus and they give the directly chili, the chili water.
Thank you.
आपकी बंद रही है।
This will open my smell. I love this. Then it's too good. Yes.
Which one is that? It's not break, okay? Continue.
Sorry, my bad.
No, it's okay. No, they can eat. It's good for liver. No?
Sushi cannot eat the
Vitamin C for the liver. Yeah.
Who's the pussy? I don't know. I forgot now.
2 more.
Okay, next one.
You-
UB23, kidney 10.
He wants to give you one.
No, I don't like that. My liver is a little bit contract and dry, so I don't like this taste, and I don't eat this taste. Whenever someone liver dry, they don't like
This is why
orange.
you green tea bitter.
Really?
Yeah.
If your liver is contracted, you will not like the taste of citrus fruit.
But you should have it.
Yes, if you do the
You like the
it will help.
bitter taste.
Yeah, it will
Yeah.
help. Okay, so kidney 10, kidney 1 is actually like vata point, but kidney 1 is little bit emergency point. Kidney 1 is emergency point, so we will not use everyday kidney 1. So what we'll use? We'll use kidney 2 for the vata. Okay, and this point is very effective point for to improve your circulation level and the filtration level inside the kidney. Okay, very effective point. Where is kidney 2? Mostly I never target exactly on the point. Okay,
It's the fish.
so no, okay, mostly I go, I check here. Okay, you will find some bump here. Here, between these two,
On the right side.
Depends.
On the right kidney and right.
There's a bump.
Okay? Yeah. You will find this small tightness here and bump here. Okay? And when you press, no, that patient are feeling very relaxed. When you press on that bump, no, the patients are feeling very relaxed. Okay?
Big benefit.
So,
Sometimes-
sorry.
It's like between here and
Yeah.
here, mostly here in this area. From the crease, can you see the gap crease? From here to above, somewhere here like this, when you touch like this, and you will find a small bump here. Okay?
Yeah.
Like I find here.
Yeah.
Okay? This one, when you press, you feel good relief.
I'm feeling pain.
Yeah.
Then you press it more like sharp.
Here?
This one. Yeah.
You feel the pain?
Okay, always here between these two. Okay, when you find like this, which is the most sensitive for her, this part is the this part. And then press it. Okay. Now let's go very slow.
Yours feels soft now. Yeah, this pain.
Yes, yes.
Feeling better?
What was happening there?
So for me, I can feel pain.
Your arms.
Yeah, this one.
Yeah, pains.
So this is chronic one.
What-
Yeah,
what-
on Sanjay that is very big one.
Oh,
You can
really?
sort to proceed.
Can I feel?
It's painful, man.
You can sort to proceed.
It's
very
painful.
easily. But his was like very big one. So. What is?
Me too.
This is the left. You need to
So
do
what
the
is-
right.
It doesn't matter. It's why
Just. What did you say? And Baba, kidney 1 is Vata point, but kidney 1 is emergency point. So in such case, we use the kidney 2. Kidney 2 also help for Vata.
I need to fix this.
reflexology.
Yeah, it's good for the all Vata issues inside your kidney. Yeah. So, for example, for me, I use when I had a little bit of like yellow urine and so on, I use this one to give them of my completely proper relief. Okay, so very effective. Sometimes the frequent urination will increase because if there is more toxicity, you will take out that. Okay, so this is very effective protocol for the kidney dryness.
We can.
Kidney dryness.
So in kidney dryness, you will not find any case. Means in my life, I have not seen any case the cracked tongue on the kidney. But there is many contracted tongue. Yeah, many contracted tongue.
Apply pressure, pressure.
Very good. You can apply the pressures too.
The right also pains, but
So
less.
what's the meaning of the sensitive sensation?
This means
It's not painful. It's just
You can check his-
sensitive.
My pains.
Pain.
second big one. When you press, usually you can feel that like this, like types of the cyst like that. So if the more chronic one, then the patient will, there is more big one. Like if you check for uric acid patients and kidney stone patients, this type of the patients, like creatinine level patient, you will see the big one.
And it's painful. But painful is different than sensitive, you know.
Sensitive is very acute one, giving good relief. Okay, and the pain one is like, see, on the same point, if you are giving too much pain and trying to break that one, that will help a lot. Okay, like use some instruments and try to give more pressure. But best one, give this, put the oil, okay, like this is the point, pull the little bit oil and try to give
Massage.
this massage.
To remove the
The knots.
the knot.
Yeah, it's like air, trapped air.
So if you see,
Your expertise.
yes, if you see, there is lots of the small
That's
veins.
the spine, isn't it? Like all this part is the spine. Like at the edge is the spine. So like if someone has air in the
It
spine,
means the palm and foot acupuncture pressure, right?
yeah.
The spine
There's
you say
bubbles.
is the outside part.
I thought it was this part. The inside? I didn't study reflexology, but
Inside, inside.
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 Oh, it's 2 against 1.
Depends. There are two, like
Two
the Thai,
spines.
for Thai people they have one system. For Chinese they have different system.
You need to remember gradient versus.
So they chart the chart change depending the.
You studied Chinese?
I didn't study anything. I'm just curious.
Yeah,
Just,
very-
I just know.
These are very advanced people here.
Okay? In these conditions, we use the UB23. UB23 is like a soup point of the kidney. Just for the now, I can,
UV?
23.
Next now.
Urinary bladder.
On the kidney. Exactly on the kidney. Mostly in acupunctures, they mentions between the L1 and L2. In acupuncture books, they mentions between the L1 and L2, but as per anatomy, L1 and L2 is little bit lower than kidney.
You have to go just.
Okay? So, we are doing between the T12 and L1. We are using this point between T12 and L1, that is little bit more effective.
And close to the spine.
Yes, 1.5 chun for the kidney yin and 3 chun from kidney yang. So what is the kidney yin and yang? In each and every organ, we have yin and yang. So yin means for the internal function, and yang means the contraction and relaxation.
Oh.
Okay? New subject for you, right? Any organ, we are talking about liver yin, heart yin, kidney yang. Yin means in one organ, when we are talking, we are not dividing in the parts like kidney and bladder. In the bladder also we have yin and yang. So in one organ, when we are talking kidney yin and yang, so that means the internal function is yin. Okay, what is going to enter? Okay, what is going to enter in that organ and doing function in that organ? That is the yin. And what is exiting from that organ? And what is the outer layer of the organ? This two is yang. Okay, what is receiving? That is yin. What is giving? That is yang. Okay, so UB23 is the backsu point of your kidney yin. Okay, for the kidney yin.
And then the yang is.
Kidney 10 is the point, the kapha point of your kidney, and kidney 2 is the vata point of your kidney.
We put the needles with the flow of the meridian.
Yes, ma'am. Okay. You can give perpendicular, okay, and you can go a little bit of the like with the flow. It's tonification needle. Moksha is very important. Mostly we avoid the moksha on the vata point, but only in the kidney we give the moksha on the kidney too.
Oh.
Okay. Mostly we avoid the moksha on the all the vata point. We don't give the point on the vata point because very sensitive, no? But on the kidney we give, there is more
Right.
effective.
Right.
Yeah. When we come on the psychological acupuncture, we'll discuss about these kidney points more. It's very effective points. Kidney is not, as per psychology, when we talk about psychology, kidney is not filtering only essence and fluids and acids to solve. Kidney is to filter your all congested memory and unwanted memory from your body, and kidneys filter your emotions too. So when we heal the kidney, we are going to heal all over the body. Doesn't matter if that is the emotional or the pathological.
Whatever it
That's why
is.
it called the mother of the all organ. Kidney is mother of. Mother is not washing our when we are in body. Mother is not giving bath. Mother is washing everything. Mother is cleansing all the body. Right? Mother will not think, no, I will not wash this one, I don't wash this one, or this one, right? Mother is not dividing. This is my son. Okay? And with pure love, mother will give you bath properly. Okay? So quickly, that's why called in many books, mother of all organ. So mother of emotions.
Is there a protocol of like detoxify the whole kidney?
This is the protocol.
Yes.
23 days into
Yeah, only 3 points.
Huh?
Only 3 points.
This is enough, then we'll use a little bit of the reproductive protocol.
But otherwise we connect kidney to fear, no?
Mama always have fear. Oh my, my son is going to damage his knee, maybe. Okay, protect him. How she is acting? Not for herself. Mama is have lots of the fear, not for herself, for
The child.
others. Okay, so always remember the fear inside the kidney. Okay, it comes from the different organ. This is the very deep meaning of the source. Fear inside the kidney is not because of the kidney. It comes from some specific other experience, trauma, anything which is wrong. We'll discuss when we start the psychology. Fear inside the kidneys comes from some specific other organ or other emotions, or maybe past some experience. When your kidney is not going to heal that specific memory, when your kidney is not going to filter that specific memory, then your kidneys again and again see that, oh, that's the problem, that's the problem. That's why I said, no, when we mix the pathological and psychology both together, and it's like amazing journey. Understand? Okay, we'll do the small protocol of the kidney for everyone. Okay, and girls, you do the little bit of the reproductive protocols. Parents are right. Okay, we'll do one reproductive protocol. Reproductive protocol is very good protocol for your ovary, testicles, and for your urinary bladder and for your uterus.
Wait.
उसको बोलो नहीं सेम वाला एक ग्रीन टी बना देगा.
Ovary, testicles.
The reproductive protocol what we are going to use. That protocol is used for the testicles, ovary, urinary bladder, uterus, and you can use the same protocol for process too.
Okay.
Reproductive means what we have in the all in this area, we can fix through that only one protocol, because this protocol help a lot to circulate all the nutrients, protein or whatever is congested in this area. Okay?
It is just called the reproductive protocol.
Sorry. RAN 2, RAN 3, kidney 11 bilateral, ST30 bilateral.
ST.
30.
Yeah.
ST30 bilateral is exactly on your ovary.
What testes before the send?
Still some branches of the testes is going from here only, okay?
It works.
Okay?
So this also will work on prostate, you said, not that DU1 or whatever it is.
Okay? Yeah, we discussed when the D1, then
Yeah.
we discussed now, we will come on the reproductive protocol. That protocol is very good for testicles. Okay, and prostate too. Okay? Kidney 11 is directly on your center of your all reproductive, which means you can mention on your vagina or the root of your penis or meeting area of your ovary and testicles, and on your head of your uterus, urinary bladder, the wall of the urinary bladder. Okay, this is the whole area.
Kidney 11.
Okay, so for example, if you see like
But you're not going to puncture an organ, right?
no.
We are still far from this, so you're not using big needles.
25.
REN 10 2, REN 2 or 3. This is the very good point to detox and cleanse this whole area, the center area. Okay, very good to detox this area. REN 2 and 3. 3 for the urinary bladder move point.
Last time I used one lady.
You use now? How is it?
I asked today.
Okay, let's do one small practical for this. Do on each and every just make a partner and just I will show you the mark. Now one leg is girl, sorry, ladies. Okay, lie down here. Oh, you can come beyond back. This. Any girls who have issues, we have good chance to get treatment.
I obviously have something else.
Come on.
So far as I don't know.
Can you do it?
Somebody organized some course, and mostly I prepare like graduations. So someone is organizing one. Can you bring your phone? Where is your phone?
Oh, I totally forgot that.
Okay, so like after lecture of the reproductive, one of the students he asked, so so this is used for like a boy's uterus also, and I said yes, you can use for boy uterus.
Oh my goodness.
Then I give signal. See, that's why I'm not taking to everyone's who is little bit of graduate. They know like what is the difference between uterus. Okay, uterus.
On top of the clothes, or you need to do?
Mostly I suggest to do not cross, because many people they are not comfortable with they are saying like, oh, you are going through the cloth, what will happen inside? The people have little OCD issues, so objective. Mostly I say to patients, please because
put it
this
down
is
a
this is just above the hairline. Okay, you can come right.
I need to go to the toilet first. I'm bursting.
You can
I
come
will
back.
do it, no problem though.
You can come fast. No need reproductive protocol. It's very good for the after like delivery. This reproductive protocol
Perfect
is
for
very
you.
good.
Chalo.
Okay, after the delivery, this protocol is very good to filter and to cleanse your all this area,
Oh, okay.
ovary and uterus and this.
After delivery.
Okay.
After the menstrual cycle, you can use before the menstrual cycle, like menstrual cycle after for 5 days, just use this protocol. So your menstrual cycle will be more. See that girl?
Go, we wait for you.
Yeah?
2 minutes, yeah, I know.
Yeah.
Just
What is
stop
this,
the video
7.5?
for 1 minute.
This is the 4.
Yeah.
This is the 3, and
Wait
this is the
1
2.
minute,
Yeah.
Inami, she's coming. 1 minute. Wait 1 minute.
That's so. This was 8, right? Yeah. 1, 2.
Yeah, so we'll not count this one. We'll use the 4 tune. Then we'll reach 3, and 1 tune down.
This 2.
2.
Yeah,
Last
this is easy.
time.
No, each number is a tune.
DMI with
Village.
I choose
In
that
Ren.
part.
Sorry.
He's the serpent of that village.
That lady.
guy.
We will do DMI.
village.
Last.
Oh, and then you chose this one.
Okay.
I put it there.
So use
Why?
number what treatment?
Just take it on
He's come for treatment. No, he's just come for meeting.
Achha, okay, I thought he came for treatment. Oh, she can't see. She's getting stressed. She's getting
Can
stressed.
I'm gonna
या
change
वहाँ
the.
जाके तो चेयर ले लो.
I know. अचानक नहीं रास्ते में है वो. She's in the train.
So,
This dedication.
तुम मॉडलिंग ज़्यादा करो. ज़्यादा देर तक.
क्यों?
Because we are waiting for Patricia.
okay, very
Very
simple.
down.
See, fortune from the navel. This is your ran 3. Ran 3. One tune below this one.
Ran 2.
Ran
That's
2.
easy. That's not so
Very
far.
easy. Okay.
People should
This
not
2
feel-
point always trying to give moksha. One day moksha, one day you can give electro like this, because moksha will help more to cleanse that part. From the ran 2, see, from the ran 2 half tune lateral.
2 and 3.
From the ran tune half tune lateral, this is your kidney 11.
Ah,
From
okay.
ran to half tune lateral, kidney 11.
Both
From the
sides.
kidney 11, 1.5 tune is your stomach 30.
So 2 tune from the.
2 tune from center, exactly same. Stomach 25 from the side of the
Yeah.
navel.
Correct.
Okay? Because 1 tune is your navel, no?
Yeah, from the center it is 2 tune.
Yeah,
Right.
from center. So from the this 1.5 tune is your kidney. Sorry, stomach 30. So see the one electro here, one electro here. Okay. With this, sometime if you use stomach 25 bilateral,
Yeah.
because on the urinary bladder and uterus, the lots of pressure comes from your large intestine too. Okay, and one electro here. So one electro, 2 electro, 3 electro.
That's it.
Proper electro, 1 moksha, 2 moksha. Okay, this is proper protocol for your reproductive protocol. Any types of issue, PCOD, PCOS, anything.
Oh, really?
Yeah, if
What is this?
Perimenopause.
PCOS,
You know what
many-
PCOD is, right?
I have 2-3 cases which is menopause help a lot.
Okay.
One lady is after the 2-year menopause, the menstrual cycle start again.
I'll tell you. I know it very well.
Okay. I am very confident with this protocol is helping
So,
a lot.
and if
Most of time, sometimes girls is complaining for hormonal issues.
Because this is such a
headache
big issue
issues,
with young
pure
girls.
the reflections of your reproductive protocol. Just use this. This will have more. We use distal point only this two. Kidney 3.
Yes.
You already knows where is that. Kidney 3, and
called
from here,
PCOD.
this bone, we use the 2 tune. This is the kidney 6. Kidney 6 and kidney 3. These 2 distal points, and you can give the moksha on kidney 6, ran 2, ran 3. Okay. If the ladies is very skinny, then please don't give electro, and if you want to give,
Too much
then
vata
insert
then.
needle very superficially. Sir, अंदर जाओ, अंदर है. इधर से जाओ अंदर. Okay.
And if the lady is fat,
Fat, then use the 40 size needle. Okay. Proper inside, like in her body, we
75.
can use the 40 size, 40.
40.
40, yeah.
For
No,
if
for,
it's
for her.
If it's fat.
for me,
It's more fat, and you can go 60, 60, 75. Okay. For her, we'll use the
40 is
for
enough.
her case we use the 25. But this 3 of we can use 40 size. Okay. 40 size needle, proper electro. After the electro, okay, we'll give the moksha to kidney 6, ran 2, ran 2 and ran 3. And with this, if you want, you can use the in time. That's very good point. Okay. And if there is a PCOS, PCOD.
Yeah.
Only in the PCOS, PCOD, then spleen, pericardium 6, PC 6, okay, from the wrist, 3 finger, okay, exactly on this same other side, this is the TW5. What is TW5? These both are, if you remember, we discussed PC6 and TW5 is very good point to remove anything stagnation and to melt the cyst. To melt
We didn't
the cyst.
discuss this. I don't remember.
Triple warmer. Triple. We didn't.
Oh, yeah, in that.
Very
No, we
good.
didn't
We
discuss
discussed
this.
in the very veins.
Oh, we did.
uh,
Not in my bloody notes. Maybe I'll go back.
It's okay. No, you can. Okay. So PC6 use you can left side, and pericardium you can use the right side. So both hand will be like this. Okay. Exactly on the same opposite. They both point are opposite. From the 3 finger from the here is PC6, and exactly on the 3 finger from back side this is TW5. Okay, this is the point like.
So could you repeat what is the meaning of both?
These 2 points we use only PCOS, PCOD. If there is fibroids or anything like that, we use this 2 point. Healing tank is just to relax the body.
You must be getting a lot of patients with PCOD because
Yeah.
half the young girls I know they have PCOD issues.
Oh, that department now.
That's polycystic ovary.
We can use bilateral or
You can use PC6 on left side and TW5 on the right side.
I have 2 daughters, man. I know a
what
lot.
is the protocol if it is reproductive?
Oh yeah, girls teach you a lot.
Sorry,
Prostate, you don't need to use this one.
you used to have.
Yeah,
Only
Only this protocol will be enough.
Yeah.
like no period.
For prostate,
Because
this,
my younger
so see,
one wants to check,
see, in this point will not change any point. Only will mix these 2 point only in one condition if they have fibroids, PCOS, PCOD. Otherwise, ovary issues, uterus issues,
This is like a health tonic generally
yeah,
also.
any types of the reproductive protocol. This is the fixed protocol.
prostate.
Kidney, yeah, prostate also, testicles also, penis, vagina itching, frequent urinations, all types of them. Okay, these 2, kidney 11, half tune from the REN 2, stomach 30, REN 2 and REN 3, and stomach 25. Okay, kidney 3 and kidney 6.
How many points are here? 1,
2,
2.
3, 4, 5, 6, 7, 8.
We don't show because of the time.
1, 2,
Kidney
3,
6.
4, 5, 6, 7.
8. See, kidney 11 bilateral,
Kidney 11 bilateral. Yeah.
stomach 30 bilateral,
Okay.
stomach 25 bilateral,
6.
REN 2, REN 3.
7, 8. Okay. 8.
Above
25.
bone.
So you can
And
use
if
like
you have
this.
PCOD, then
See,
2
you can
more.
use like
2
this.
more.
Before you use that kidney
Four.
protocol,
And then-
EB23 back point
डालो.
and
डाल रहे हैं क्या? Are we going to?
Yeah.
Now she's like मुझे
but,
करो.
but don't give that electro, okay? Because she already has a features. Yeah.
मोक्षा करो मोक्षा.
जो भी करो सही. मेरे को ऐसे.
Kidney 6 यहाँ से 2 चून यहाँ पे आ जाएगा.
पानी तो नहीं डाल
Kidney 6 या 7 है, I think, I don't know. Just a minute.
नहीं 7 है.
That's 7. Then just write
Kidney 6 तो मैलिस के
7. Then write the 7. Here. Okay. Kidney 7 here.
Kidney 7 and 6.
No, only 7. 3 and 7.
3 and 7.
Oh, not 3 and 6.
Now you can insert the needle.
Where is this? The three one tune below,
40. She's 40, right?
one below.
नहीं 25 में ठीक है. क्योंकि मुझे मोक्षा देना पड़ेगा ना.
So this is the bone.
बोल तो हाँ.
One tune down.
संजय.
Oh yeah.
Kidney
मोक्षा देना पड़ेगा.
1.
2.
And a half. Kidney 7.
Kidney 1 is here.
And what is this? Kidney 3.
There's kidney 2.
Who's doing this? Lavi?
This one is the kidney 3.
ಇದೇನು ಇದು?
Numb. I can't even feel any touch here.
ಕಿಡ್ನಿ
Really?
3, ಕಿಡ್ನಿ 7.
What?
Because even if you use 25, it's fine. It's not a problem.
Yeah, I'm
There's no
okay.
40. Or what did he say? He said 40.
He said 40 because she's not.